All right, everybody, this is Dr. Jeff McNairy, Chief Medical Officer at Rythmia Life Advancement Center in Costa Rica. Today we're going to talk about a subject that's really important to me. It's called cure personality disorders. So really what I'm talking about with this discussion are labels that are given to people. So diagnostic labels. For example, if you're considered an addict in the medical world, it's a label that you have kind of like put on you, right? And if you have borderline personality disorder, that's a label also that is put on you. Antisocial, narcissistic, obsessive compulsive personality disorders, right? There's all these there's 10 different personality disorders. And basically what a personality disorder is, it's a grouping of symptoms that a person exhibits that kind of puts them into a category. And what that's used for is to kind of work on a treatment plan or a kind of a therapeutic approach to help them get better, right? But the way the medical model looks at personality disorders is that they're not curable. It's who a person is. And who that person is considered dysfunctional in the Western model. And the reason for that is because personality disorders are considered egocentric. And what egocentric means is that I don't understand that my belief system and my view of the world is inaccurate. I believe that it's accurate. So what I've mentioned before in other Facebook Lives is, like, for example, if I get mad one day and I know that I went over the top and yelled at somebody, I can tell myself, like, yeah, you know what, that wasn't appropriate. That wasn't cool. I was, tired and upset. And so that would not be considered egocentric. What egocentric would be is that, that person deserved my anger. I was justified. And the way I did that was appropriate. And they had it coming, right? So there's like a different sort of view about your behavior in that social interaction. So what I really want to talk about tonight is the labels that psychiatrists and psychologists have to use in the system that they're in. So I'm not knocking them per se, but I'm knocking the system that facilitates that. Because, when I was working in LA, if I didn't give my patients a diagnosis, and if I didn't label them with a criteria, whether it was a personality disorder or a conduct disorder or an addiction disorder or any of these things, anxiety, depression, whatever, then that patient could not receive reimbursement from insurance. And they also could not be plugged into a system. For example, if they were at the psychiatric hospital, they couldn't stay there if they didn't have a diagnosis. So the whole system kind of like revolves around these diagnoses. And so what happens, if you're the individual, you hear, right, from your psychologist or your psychiatrist, you have this label. And then, because you're smart and you go home and you look up what it means, and you say, wow, I'm suicidal, I have self-harming behavior, I have addiction issues, I can't emotionally self-regulate, I have poor relationships, I have eating disorders, I'm screwed because this disorder that I've been told I have means that I can't ever change because I'm egocentric, right? So now if I'm in crisis and I'm stressed on life and I'm going through some rough things, I just go, all right, well, I got to throw in the towel. There's nothing I can do. Because I have borderline personality disorder, or I'm an addict, or I have anxiety, or I have depression. And so now it's just woe is me, and I gotta just lay down, accept the medical kind of protocol that's gonna ride on top of me and try to help me get better. So, it's such an interesting system, right? Because there's these legal things that we have to use, and these criteria that are kind of built in to try to organize everything. And there's the actual patient. And the patient needs to be empowered. The patient should not feel, oh, well, there's nothing I can do. I'm screwed. I have this disorder, right? So it's the clinicians that are involved in therapy with people that have these quote unquote diagnostic labels, and especially personality disorders, the clinicians are kind of on the fence. They don't really like labeling people either, but at the same time, they see that these groupings of traits are leading them down a therapeutic path that can help kind of work with them in sessions, right? So the bottom line is this: if you are somebody that has been labeled with a personality disorder or a clinical diagnosis of anxiety or depression or PTSD or addiction or whatever else. There's like the DSM, by the way, the manual that has these diagnoses is like about this thick, okay? So there's a lot of things in there that are diagnosing people and labeling them. So if you're one of those people, rise above it. Rise above it. Do things that get yourself centered and help you resolve whatever turmoil you might be having. And the reason why we're having this discussion is because since we've opened at Rythmia about 3 years ago, we've seen almost, 3,500 guests. A lot of them, I would say probably 80% of these guests that have come here have been labeled. They've been labeled in psychiatry and psychology with, you name it, disorders, you name it, personality issues. What we've seen here happen is truly a miracle because people get to plug into themselves. They get to resolve and understand why they're behaving in a certain way that they are in their environment with relationships and with their, if they have substance abuse issues or if they have job issues and family dynamic problems. They're able to plug into themselves and see their role in it and understand why they have this trauma or why this history of events is impacting the way they're operating in their life. And what happens here at Rythmia is that you heal it and you move past it and you resolve it. And so, in the Western model, personality disorders are considered incurable. I personally do not believe that anything in this world is incurable. Nothing. I don't believe that any disease is incurable. I don't believe that any psychological condition is incurable. I don't believe that anything is incurable. And call me a rebel and call me a rogue, therapist and call me a person that's crazy or whatever. I don't care because I've seen it happen thousands of times. I've seen the changes and the shifts that people can make. It's up to the individual to heal themselves, and they can do that if they're focused. Now, how do you get focused? Like you're in your life, you're busy, you're working, you have all these stressors, you have kids, you have a spouse or a partner, or you're alone, you have anxiety to leave the house. There's all these different situations, right? You have a drinking problem. There's all these things. How do you cure yourself if you're overwhelmed and bombarded with life and you just kind of got beat down, right? How do you do it? Well, there's a million ways and we could go over that for 5 hours, okay? But the way that I prefer, and I've seen it all, okay? I've seen it all. The way that I prefer is doing what we have lined out in this week-long program at Rythmia. You connect with yourself, you heal your heart, you reunite with your soul, you connect with who you are as a person, you get focused and back on track. There's support, there's clinicians, there's holistic healers, but more important than all those people is yourself, because you get to do the work. You get to have the benefits of all this hard work that you do because you're doing it for yourself. You ever had somebody do something for you? And it's nice. Yeah, thanks for mowing my lawn. I appreciate it. That was actually a nice neighbor. Thank you. That was cool. Have a lemonade, right? Thank you. But how much more satisfying is it when you mow your own lawn and you do it yourself because you have an accomplishment, right? And you've done something for you. It resonates more. That's what Rythmia is about. You don't need clinicians and psychiatrists and all kinds of different doctors and therapists and counselors and all these different healers and practitioners, all these different, you don't need them to do anything for you. They're very cool people. They're very nice people. I'm one of those people. Okay? We're all pretty cool, generally. You don't need us. What you need is yourself. You need from us, right? These healer people, all you need from us is a safe environment to do this work for you. You don't need me to tell you anything. I have my own biases, my own misunderstandings, my own confusions, and my own personality, my own issues, my own stuff. You don't need me to tell you anything. What you need from me is to create a safe environment where you can do this work yourself. And that's what I'm doing, night and day. I'm creating a safe environment at Rythmia so you can do the work. You can go deep. you can feel safe to let go and get to where you need to be to heal your own issues. That's what this is about. And that's what real healing is. Real healing is not about receiving all these orders from a doctor and all these meds and going in and out of a psych hospital or a rehab. That's not what healing is. Those are things to prevent liability. Those are things to keep your family happy. Those are things to keep your job happy. Those are things to kind of like Band-Aid a couple things. That's what that's about, right? And you know what? And fine. If that's what you need, then fine. But if you want real healing and deep, deep soul connection with who you are as a person, and you want to excel in your life and thrive and get to all the things that you can do as a person and achieve amazing things that you never even thought were possible, heal yourself. Do the work yourself. Do it in an environment that is safe, and that's what we are here at Rythmia. That's what I'm doing. That's it. Pura vida from Costa Rica. Cure your personality disorders. Get rid of anxiety and depression and addiction and all this crazy nonsense that is not relevant to you, and heal yourself. I can't wait to meet you. Pura vida.